New family nurse practitioner in town is going to be at the Dent County Health Center. I think it's their first nurse practitioner that they've had.
That's correct.
And we welcome April Greener. Well, doctor, welcome.
Thank you so much for having me.
Well, it's a pleasure to meet you, and I know you've just gotten in town and you're getting yourself acclimated to Dent County, and you
That's
came here
right.
thinking we're going to have some nice greenery, but
We're waiting for some more rain.
we're waiting for a little bit of rain. We were talking prior before we came on the air. So you should have been here in April, May. You'd had plenty of rain, plenty of green. Unfortunately, for right now, we're a little bit shy of that. But anyway, we want to welcome you to Dent County. And first off, tell us a little bit about yourself. You're not originally from the area, right?
No, my husband and our family moved here from Utah just a couple of weeks ago. I grew up in Utah in a small farming community.
Okay, you have children?
We have 4 children. Yes.
Very good. Fantastic. We need more kids. love to have children in. And how long have you been a family nurse practitioner?
I've been a family nurse practitioner for 12 years.
12 years. That's amazing. Because when you see April, you wouldn't think that she had been a nurse practitioner for 12 years. You look extremely young for your age.
Oh, thank you.
Whether you're 28 or 12, it doesn't mean you look very good.
Thank you.
And we always really appreciate anybody that comes in from out of the area to, well, first off, you're broadening your own horizons.
Absolutely.
You're seeing something new. It's a brand new, different thing. But some things don't change. You said you grew up on a farm, right?
That's correct. Yeah, I grew up on a dairy farm, had a lovely childhood there, and really wanted to get back to that for my own kids.
So some people in Dent County may have already met you out at the pie auction that was held Wednesday night out at the Commons, correct?
Yes, I was there, and it was a great night to support the youth. I grew up doing 4-H, and that was important to me.
So you got here, you find out about that, you just had to go see it, right?
Yep, I just saw a flyer in our break room at the health center and wanted to go that night.
Did you go out to the auction on Saturday?
No, we didn't make it to the auction.
Yeah, okay,
So, and I want you to know the pie in the stall and it was delicious.
Oh, good. Very good. Well, again, we thank you for coming here, but we have some business to talk about, don't we?
Yes.
Yeah, there's a lot of things going on right now, and it's a very busy time, obviously, with the heat. So a couple first things off. You guys do your normal general things at there, but we do need to watch out for the heat right now, don't we?
Absolutely. So heat warning right now. Make sure that you're checking on people that you love and checking on your animals, staying cool, drinking lots of fluids.
Drinking lots of fluids. And I think a lot of people think that's while you're outside and things of that nature. You really need to hydrate ahead of time, don't you?
Absolutely. And then when you're outside, twice as much as you think.
Yeah, and then when you get in, you want to cool yourself down slowly, right?
Absolutely.
Yeah. Don't want those sudden changes in temperatures going from 105 degrees inside to 65.
Exactly.
That can really kind of throw your system conky-bunkered, right?
That's correct.
That's very good. So one of the things that we want to talk a little bit about, obviously, it's getting near back to school time. You guys are going to be at the school on the senior day because seniors do require a meningitis shot, correct?
That's correct. We are going to be at the Salem High School on July 25th for the senior registration, offering vaccinations that the seniors need.
Okay.
And then I'll also be there offering physical exams for sports. So if your child's playing a sport and they need a physical exam, we'll be at the school offering those that day as well.
So you do need a parent there if they're under 18,
Yes,
correct?
yes. So with parent permission, yes.
Okay, well, make
Thank you
sure.
for reminding me of
Yeah,
that.
I want to always. Every state's a little different, and maybe where you came from that wasn't explained to you, but yeah, 18 here. So if you do need to get a physical, if you are going to participate in sports, I think most of the people who'd be participating in football and them will probably already have them, but if they're going to do basketball, they can get it done right then and there.
Exactly. And then, too, if that day doesn't work for you, the health center is open Monday through Friday, 8 to 4:30, and we can do the physical exams anytime during that time as well. You can call and make an appointment.
Let's make, I know we just jumped to the high school, and we're going to do a little jumping around here, but when we talk about general services at the Dent County Health Center, I mean, this is for anything. Right now, we've got people who may get bitten by a tick, or they may have a tick, or they may get into poison ivy. Now, right now, it's kind of dry, but I think I got a little bit. It can happen anywhere. When you have an issue like this, if it lingers or you had a problem or a tick bite you definitely don't want to play with, you definitely want to go to the health center and get that checked out, don't they?
Absolutely. So I've just been amazed, honestly. When I came into this position, I didn't know all that the health center offered. They offer so many services that I even wonder if the community knows what they offer. So we offer, of course, vaccinations. We offer a lot of lab services, really any lab that you might need, including like to work up tick-borne illnesses. We offer, of course, like any type of care that might need from like animals. If your animal has a problem, we can work with the state for that. And then, of course, some of the services that I'll be focusing on is managing any illnesses. So hypertension, tick-borne illnesses, physical exams, and then really my specialty is women's health services, and that's one of the main goals that the health center wants to really focus on.
Right, and they offer a number of different women's health services,
Yes.
correct, don't they?
Yes.
Now let's start explaining a little bit about those services. Obviously, family planning services.
Yes.
Let's talk a little bit about that, if you wouldn't mind.
Yeah, so, Dent County typically has a higher teen pregnancy rate than other places in the nation. So one of the focuses of the health center is to lower that rate and to offer family planning services to all people who need it. So offering birth control at a very affordable price is something that we're focusing on. And we have many options that when patients come in, they can sit down and have an appointment with me, and we can discuss all the different options that we have and choose one that's best for that patient.
And it's very important that those patients are open and honest with you about maybe their prior sexual health or any different activities that they may have incurred, because you need to know ahead of time before you can really start making those plans, don't you?
Yeah, absolutely. And one of my goals at the health center and just in my life is to create a space where people feel comfortable to share those things. I really take pride in what I do, and I feel like it's an honor to help people in what can be a vulnerable or uncomfortable situation. And I think that that's something that brings me a lot of fulfillment, is to be able to help people and do that.
Well, very good, very good. So not only family planning, but also in women's health treatment,
Yes.
breast, cervical cancers, different
That's
things
correct.
of that nature.
So the Dent County Health Center has partnered with a program. It's called Show Me Healthy Women.
Right.
And they offer so many services to patients who meet criteria. So there are some age and some income requirements. But if you meet that requirement, then you can get free cervical and breast cancer screening. And it's the exact same screening that you would have at any other clinic. And also they do things like if you need a blood pressure cuff because you have high blood pressure, they can work with you to get you a blood pressure cuff. So the services are wide and expand far more than just breast and cervical screening, but that's really two of the ones that we focus on and want to capture patients that need that.
And because, as you mentioned, income levels, when people start thinking about these type of things, they're scared off by how much this is going to cost. I can't afford this. I don't know where to go. And the panic kind of sets in sometimes too. There are answers, or there is help out there waiting for you.
Yes, absolutely. And again, like I just feel lucky to have this position because it's really about providing good health care for people. And if you don't have insurance, then sometimes we can get you qualified for these different programs that we have. And if that doesn't work, we have very low prices for cash payment for most of our visits. And so we really try hard to make it affordable for patients to get the care that they need. And coming from Utah and working in a clinic that was a little different, like I'm just shocked at how low the prices are for the services here. They're really, truly good prices.
And a lot of times, this is not just for breast and cervical cancers and screenings and things of that nature, but a lot of people just get confused by what they might have or what the symptoms are that they might have, and they're afraid, but they really need to tell you what those symptoms are or what they're experiencing, because you can't really give them the right treatment unless you know the whole story.
That's right. I always try to tell patients that the more that you can help me, the better I can help you. And that's just part of that relationship that comes with the patient-provider relationship, and sometimes takes time, but definitely,
Sure.
We always want to provide the best outcome for people.
But there's that trust factor.
Yes.
You have to trust your doctor, and the doctor has to trust you to give the doctor the information that they need to make the correct diagnosis. If you're not telling them the whole story, or you may say, well, this only happens once in a great while. That's okay. Tell them it only happens once in a great while, or it only happens on a full moon every other month. It doesn't make any difference. It may not mean anything, but it might mean something, correct?
Exactly. Yes, you're right.
So it's always good to just be very, very forthcoming with your feelings, anything else that you might have. A lot of times, doctor, there's and I've experienced this with friends of mine who have been diagnosed with cancer, is there's this depression that comes on because they don't think anybody is there for them. And it's this is one of the things that our Dent County Health Center does offer. They offer that compassion. Come in and let them help you. There is help out there. There are people that can work with you to get you back to the proper health you need to be. You're not on an island by yourself, are you?
That's right. And I think, too, it's important to remember that it's okay to, I think sometimes in society we feel like we can never be sad or be depressed or anything when sad and depressing things happen to us. And that's okay to feel that way. But it's okay also to ask for help. And that's what we want to do, is offer help. And that's something, again, that's very fulfilling to me, is to try to help people and just let them know what's out there for them.
So with the Show Me Women program, are there specific days that is held? Or I know they have to make an appointment, but I thought there were specific days that's held.
That's a
during the
great
month.
question. Yeah. And no, we're open Monday through Friday and offering those services from 8 to 4:30 every single day. So
since you got here, you're kind of offering
doing it
that
daily.
service 20.
Yep, daily.
20-something days out of the month.
That's
obviously,
correct.
Except, I guess, for the weekends, it
Yep.
might be closed. So, very good. Well, that's wonderful to know. That was something I did not know.
It's exciting for me, too. Women's health services is definitely my passion. And so to be able to offer that to the community here is great. I volunteered at a clinic in Utah for 7 years, and that's what I did there. Was they had a very similar program, and it was my favorite job that I've had as a nurse practitioner.
So, are you there Monday through Friday?
Yes.
Okay. So
Yes.
let people know you are there Monday through Friday. So you're there every day, 8 till
4:30.
4:30. Okay, very good. All right. So let's kind of move on. But anybody that has, if you're a lady out there and you want to be part of the Show Me Women program, that program is available at the Dent County Health Center. Just contact them. They can give you all the details. You don't have to talk to the doctor. They can give you the details. You can walk in. They have plenty of details at the desk as well. The girls there are great. Fantastic.
Yes, they are.
And
It's a
they'll
good
take
team.
care of you. Get that information, because if you need that help, it is available. There might be some paperwork to fill out, as you mentioned, for some income guidelines. But it's okay. Just go ahead, fill it all out, submit it, and let them help you.
Thank you.
Let's go I want to get a little bit back to school, and I know we talked about you being up at the high school on July 25th. Have you been to our high school yet?
I've driven by it, never inside yet.
You haven't been inside. Well, you can't get inside right now. It's kind of closed down. They are cleaning and doing things. But anyway, we do know, as you talked about with the athletics and coming up, but they're also, it's that time of year that parents need to make sure that everybody has their vaccination shots too, because you got a lot of kids going to school for the very first time, and a lot of parents really don't know anymore. I used to be a tetanus shot and one other shot, and that's it. I mean, that's a long time ago. Not anymore, is it?
Yeah, so, it really is a case-by-case situation based on what vaccinations they've had before. But typically, high school students are going to need their meningitis vaccine, like you discussed before, and then a Tdap, which is tetanus, and it has some other vaccines in it as well. That one's whooping cough, pertussis. That one's due every 10 years, so depending on when they had it before. And then also, we recommend the yearly flu vaccine and then COVID vaccines as well.
So there are other vaccines out there. School-age children should consider their parents. Measles,
Yes.
obviously, and then
MMR.
now, and then now also COVID is available for those young children if parents wish for them to get that vaccination
Exactly.
as well.
So if you want your child to be vaccinated for COVID-19, we do offer the vaccine for children now as well, and it's for 6 months and older. And again, you can call the health department and make an appointment if that's something that you're interested in for your
It's
child.
not a requirement of the school. It is just
No.
a parental decision to make
Yep.
for their child.
And if you have questions, if it is the right decision for your child, then again, you can always call our clinic and we can help you answer some questions.
All right. So speaking of COVID, though, I want to just kind of I know that, and you probably get tired of hearing it, but we always hear about these new strains, B1, B2, B3, B4 of the COVID-19 virus. Okay, we're just going to leave it simple.
Okay.
And what they keep telling you is that it's a mutation. That's all. It's like any other virus. It's going to mutate and change. They're saying it's very aggressive, but it's not. Doesn't have very many symptoms as much anymore. But it does spread quicker than it used 2 years ago. But if you're compromised, if your system's compromised, you just really don't know what that system can do to you. Correct?
That's correct. And I definitely think that we're seeing an uptick in COVID-19 positive cases here in Dent County. And while, yes, this is looking to be more of a milder variant, again, every person is different, and what can be mild for me may not be the same in another person, especially if they have other health problems. And I think it's important to know that there are some treatment options that we can offer through the health center that can be really beneficial to people who need them.
Okay, so I know I got vaccinated, and my second shot was in December, and then I got a booster. I think it was May. It might have been April, somewhere in there, near the end of April, early May. But now they're saying for other seniors, and there may be other seniors listening in right now, that they're saying, okay, like a flu shot, you're probably going to want to get a booster here because these strains are changing. Even though you may still get COVID, it would really hold back on the symptoms and keep you from really, hopefully, getting anything worse than maybe a sniffle or two.
That's right. So just like you said, it is like the flu vaccine that we're likely going to have to get boosters and further vaccinations as we learn to live with COVID. And the goal is that it would prevent you from having a severe case of the disease, and also that it would be have less longitude for it.
Have you heard if they're going to have a combined flu COVID vaccine coming up in the fall?
Yeah.
There's been talk of
There's been talk of that. I don't know if it's going to be ready this
year?
fall.
Yeah.
It would be awesome if it was, but I'm not sure yet.
Okay, so I hadn't heard if they'd gotten any farther with that, but I know that
Not
they
yet.
have talking. But the flu vaccine, just to make it itself, you have to plan almost a year ahead of time, don't they?
That's
and they have
correct,
to see
yeah.
what's keep happening in different parts of the world, and then they have to assume these are the strains that are going to be there, right?
Yeah, you don't need me. You got it. That's exactly
I've done
right.
this a year or two with that. But that's why it's so hard when they do a flu vaccine.
Yep, try to predict
You're
the future.
trying to predict things, and sometimes they're really good, and sometimes they're about 40% effective. But, anything that can help you ward off, you definitely want to think about doing if you're compromised, especially.
That's right. I can't say enough about how vaccines can just help us, again, prevent that severity of disease, which can be a big deal if it happens to you.
Well, very good. So keep that in mind. But let's talk about some other vaccines, not for school-age children now. Let's talk about that other side. Then you get a little bit above school-age children, like 60 and above.
Mm-hmm.
There are other vaccines out there, especially if you have had issues like pneumonia vaccine.
Yep. Yep.
Shingles
vaccine.
Different things of that nature. You definitely want to make sure you might consider them. I'm not going to say you need to have them, but if you had chicken pox, which I did, and I finally got my first one here. Zach gave it to me 3 months ago, but you got to wait 6 months. Some of these are not a single shot. You have to take
a
series of shots, correct?
Mm-hmm. Yeah, so for our population 16 above, really the ones that we're concerned about is the pneumococcal vaccine and then the shingles vaccine, just like you said. And then, of course, COVID and flu as well, like we've already talked about. And again, it isn't a black and white answer because we do decide what vaccines a person is eligible for based on their age, based on their risk factors, and also like the timing of them would depend on when they've had other vaccines.
That's
and
exactly right.
like
And
that.
people don't think about that sometimes. You need to tell whoever's giving you that vaccine when was the last vaccine you had and what it was.
Yeah, I will say I'm really impressed. Missouri has a great program, and I'm sorry, I've lost the name of it. I think it's called Show Me Vax, and it has a database where when we give a vaccine, we put the vaccine into that database, and so no matter what provider you go to, you're able to look at that record, which is so beneficial so we can make sure that we stay on the right schedule, that we give the correct vaccinations that a person needs. So that's a really nice program that Missouri has.
Well,
Utah
very
doesn't
good.
have that.
Well,
So.
very good. That's great. And I was unaware of that program, but that does sound good. Drug interaction is a big problem, and we know that. And a lot of times people will come to their nurse practitioner, come to their family doctor. They get a prescription, and then they start taking over-the-counter drugs, thinking, well, I'm going to add this and this and this. I read this on WebMD that, 5,000 milligrams of vitamin D is great for me every day. Well, it may not be great with that medication you're taking, right?
Yeah, it's always best to discuss any type of medication, supplements or not supplements, prescription or over-the-counter medications with your provider, because you're right, there are some drug-to-drug interactions, and also just to talk about if that's the best medicine for you for what you're trying to treat. So it's always important to have those conversations.
But the also good conversations is even though you might be prescribing something for somebody, let's say it's for poison ivy, and you give somebody maybe a poison ivy shot, all right? And a week goes by and nothing happened. I mean, it does happen. I actually had to have 2 shots one time. I had it so bad. The first shot, well, it got it started, but it was still not enough to shut it down.
Yeah.
And you do need to contact your doctor if you
if
think
things aren't
something's
going
not
well.
working, and then let them reassess. There may be maybe the diagnosis it was correct, but maybe it wasn't everything you have.
Yeah,
And you might need something else.
That's correct. And I wanted to see if we could go back to COVID-19 for just a second to talk about some of the treatment options that the health center has. So I don't mean to go back, but is that okay?
No. We can always
Okay.
back up. No, COVID-19 is definitely, there's a number of different options.
Yeah.
Go ahead.
So I really wanted to make sure that the community knows about the 2 treatment options that we can offer through the health department. And again, this does require either an order from your primary care physician or nurse practitioner, or you can come to the clinic and talk with me, and we can decide if it's a good treatment option for you. But one is the monoclonal antibodies, and that's an infusion for people. And you do have to meet certain requirement like age and other health problems to be able to receive that. And then the second is Paxlovid. And Paxlovid is an antiviral medication. It's actually 2 antivirals that patients would take for 5 days. And again, both of these medications have proven to be safe and effective to manage symptoms of COVID-19. And again, like the goal is that it lessens the severity of the disease, makes you have a shorter course of the illness. And I really believe in those. I've seen patients do really, really well with those treatment options. So of course, it's a virus, so antibiotics are not the answer for COVID-19, but there are some very specific treatment options, and the health center has both of those available to the community.
But COVID-19 can lead to other problems.
Yes.
That might force you into some antibiotics.
Exactly,
correct?
yeah. So, one of the biggest concerns with COVID-19 is that people develop pneumonia. And pneumonia, most of the time, is best treated with antibiotics.
Yeah. So if you let it go and you think, well, it's no big deal, it may not be a big deal when you first get it, but then after a few days, all of a sudden you find yourself a little short of breath or something else, and it may not come on you all at once. When I got my
That's right.
COVID a couple of years back, I passed out. And when I did, and they went back in, I felt fine. But I passed out. Why did you pass out? I have no idea. Didn't know I had COVID. Didn't know I had any problems. And you go in, and all of a sudden, you're in the hospital for 5 days with pneumonia and colitis and shutting down kidneys and everything. All of a sudden, it's not so peachy out there anymore.
That's right.
And you have to realize that it can happen just that
It really
fast.
can. And has no, boundaries. It can impact anybody.
Yeah, well, that's the world we live in, with a lot of different things out there, and there's going to be more. There's going to always be something else popping up here and there. You hear about monkeypox, and you hear about the brain-eating amoeba and everything else. Can't do this, can't do that, can't do this. Scares you.
It
Every
does.
time you turn around, doesn't it?
Yeah, it does. But there are precautions that we can take to still live a healthy and happy life.
Sure.
Making sure that we're all the stuff that we already know, washing your hands all the time, wearing masks has still been proven to prevent COVID-19 spread, and just, really being wise with the decisions that we make. If I'm immunocompromised, I might not want to attend something when numbers are high, or just, again, like making your own decisions, but thinking about them.
But I'm not going to try and put words in your mouth, but taking stock of your own life,
Yeah,
knowing what
exactly.
you can and can't do.
Exactly.
You know, based upon situations of your own health.
Exactly.
Yeah.
So much of our own health we really get to control. And I really like to talk to people about that because some of the medications that I prescribe and things like that are really as effective as the person is who's taking them. And you really, at the end, have the control.
I wanted to bring up one thing because we're going to be experiencing some very, very hot days. And sometimes prescribed medications on very hot days and weather and sunshine really have a lot of adverse effects, especially extremely hot. You know, you may break out in hives, you may get a rash, you may get extremely hot, you may scratch, you may have some kind of adverse reaction to that. People do need to look out for that, don't they?
Yeah, and the nice thing is that most medications that do cause problems in the sun will have on the label, like avoid the sun or, do not take if you're going to be out in the sun. So make sure that you look at your bottles. Almost every pharmacy will print that on the label for those medications.
Well, definitely want to read what the adverse reactions can be.
Exactly.
They do give you that whole,
Yeah.
when you get your prescription, you want to read that. I know a lot of people just throw it away, but you really do need to read it because if I know one time I was a lot younger, maybe 40 plus years ago, I got a prescription that I did not know was affected by the sun. And it said, avoid the sun, you can burn. And it's almost like an instant burn. I mean, I never had that. I could always tan. I could stay in the sun all day. I just had to take this. It was for some skin rash, and I took it. And I mean to tell you, I wasn't outside 5 minutes, and
you
I
felt
thought
it.
I was on fire.
Yep, that will happen.
And then I went back, and after the fact, I read it. Now, they didn't put that on the bottle back then, but they are much more aware of that now, especially. But you do want to read those, and it was sitting right there, plain as day. Do not go in direct sunlight when taking this prescription. Well, if you just would have read it and taken the time to do it, you would have known that, and you wouldn't be sitting here blistered up, But it can happen that way.
It can happen, yep.
Yeah. And just because it's not in that, description, I've had medication which I was in maybe the 1% that it did happen to. There are times that certain prescriptions just react differently with you.
Exactly.
Than they do with other people.
That's what I was just going to say is that, every person is unique. Their genetic makeup is unique. We do our best to choose the best medication for people, but sometimes what works for you might not work the same for another person, or you might have a reaction that another person might not have. So again, it's all about just following up if things aren't going well and asking questions and talking to your provider about the concerns that you're having.
Let me ask you a couple questions, and I know you're new to the area, but there are a lot of truck drivers in our area.
Yeah.
And school bus drivers now with school getting ready to go back. And a lot of these people have to take Department of Transportation exams, don't they?
I'm so glad that you brought that up because that's one of the services that the health center is adding to what we do. And so we are getting set up to be able to offer DOT physicals shortly. So stay tuned. We'll make sure to announce that on our
Facebook
website
page,
and social media pages. As soon as we're ready for that, it's going to be soon.
Okay.
We're almost
very
there.
good. They're almost.
Yep, there are some criteria that you have to meet. The provider
state
has to be
has to approve
certified.
it.
Yes,
Yeah,
so
yeah.
it's going to be soon, and that's something that I'm excited about being able to offer.
Never get the state in a big hurry to come and do it.
That's all right.
It takes a little while. It takes applications and things of that nature. I'm kind of running out of different things to talk about.
Oh,
I mean, is there things that right now for... here we are going into the hot times, and we're going to go into a very, very busy time as well with August. We know in Missouri it's usually called the dog days of August. And we usually get dry in Missouri. I hate to tell you what it's going to be, but go ahead.
Yeah, I just wanted to, if we have time, maybe we can talk about some of the lab services that we offer.
Absolutely.
So I think that most community members received a little flyer in the mail that talked about some of the basic labs that we can do at the health center. And again, very, very inexpensive. inexpensive. Some of our labs, like for example, to get your cholesterol checked is around $3 to have that done. Some of our labs you can have done without a provider order, so it's just a right to know your health information. But if you don't have a health provider, again, I'm happy to see you and I can write those orders, or you can come with an order from your primary care provider to the clinic and we can just draw the labs. And if there's any, question on price, we have all the prices that we can talk to people ahead of time so they really know what they're going to be charged if you have health insurance, and we can bill your health insurance for the labs. And again, like I was just really impressed with the amount of services that we offer at the health center. We have really full service labs at rock bottom prices.
Sure, absolutely.
We have a lot of point of care testing, which what that means is it's something that you come in right then and we can get the lab work within a few minutes. So things like checking an A1C, which is a lab that looks at your blood sugar average over the course of the last 3 months, we can have that one done right away. We can do a CMP, which stands for Comprehensive Metabolic Panel, looks at like your kidney function, your electrolytes. That test we can do in-house in about 15 minutes, which is important because we do want to check that before you were to receive the Paxlovid, which is the antiviral therapy that I mentioned before.
Right.
So we can do that in-house. We also have a BioFire, which is just awesome. When I came here, I was so happy to those are awesome. And it's a swab that we do in the nose, and then it runs and it tests for 15 different viruses. So say you're really sick and your COVID-19 test comes back negative. If you are a candidate and you're interested in looking further, we can do this BioFire test and the results come back in 45 minutes. And again, it looks at, influenza, RSV, all these different viruses that can make people feel pretty crummy and give us an answer to why maybe you're not feeling well. So I'm super excited about that. I think we're the only place in Dent County that has that BioFire. I'm not 100% sure on that, but I think we're the only ones. And again, it's a pretty amazing service to have that right in our clinic where we can give people some answers.
And of course, for those who aren't aware, the clinic did move from MacArthur over to Highway 32, 72 East, expanded the old Dr. Cunningham building, and really have done a great job with that. Have done a nice job putting in new exam rooms and things of that nature. So if you're over there before, you think, well, I've been in Dr. Cunningham's office before. You walk in there, it's not going to be the same, guys. You're going to go in on that far door. As you come in, I should say the west door, as you come in, that's where their new entrance is.
That's correct,
so you have a nice size waiting room there as well.
Yeah.
But they get you in and out of there, really do a pretty quick job.
Yes, and I will say too, I've only known this clinic, but it's beautiful inside. They've done a great job on the remodel. If you think that you have COVID-19, though, we actually don't want you to come into the building.
Right.
So you can pull into the slots that are designated, and there's a number that you can call, and someone will come out to you to serve you at your car.
Right.
And if you need to come into the building, we have a special room for that.
But if they're setting up an appointment for something else,
Yep.
that is where you will go.
Yep.
And of course, you can call the appointment. And you have the number of the Dent County Health Center?
It's 573-729-3106.
3106. So you can call, set up a time. It doesn't matter what you want to call for. You might just want to get maybe a blood test. Maybe there's one of the tests you want to have.
Yep.
There also might be something else that you want to talk to you about, just personally,
for sure,
about something I'm
Yep.
not quite sure what's going on. Can
Yep.
you give me an idea?
Exactly.
And, a lot of times that's what a family nurse practitioner is there for, is to answer those questions. Maybe you got overheated.
Yep.
And a lot of times people don't understand. You get overheated, you might get super hungry. You may not be hungry at all.
Yep.
And all of a sudden you may end up finding yourself with a lot of cramps. Maybe a little Charlie horse here or there, and all of a sudden you don't know where it's coming from.
That's right. And in addition to providing these services, I think all of us at the Dent County Health Center are passionate about education and want to really help the community. So we want people to call and come in and use our services and ask us if we have that. And if we don't, we can help you get connected to people who can help you. And two, we have WIC services and also pediatric services. So if you need child exams and immunizations, again, we're the place to help you with that.
All right. So don't forget about the Show Me Healthy
Show
Women.
Me Healthy Women.
Yeah.
Yep.
And that program is a fantastic program. They started right before COVID had to shut it down. And boy, that
We're here to make it grow
They hadn't
again.
even gotten traction before
Yep.
they had to shut down, but it's back in full stride now.
That's right. It's important. We
Yeah,
want to see it grow.
And it really is. And if you have any other questions or would like to make an appointment with our new nurse practitioner. Now, are you actually practicing yet?
Yes, yes.
Okay.
It's
I wanna make
official.
sure.
Yep.
I
It's
can-
official. I'm seeing patients and excited.
Yeah.
It's wonderful. And I've been so impressed. The people have been so kind and wonderful. It's been a great place to be. Thank
All
you
right.
guys for welcoming me.
All right, so if you want to make an appointment with Dr. April Grainer, call that number again. I'll let you give it.
573-729-3106.
And she can set you up. And I guess you're obviously being new, your docket's pretty well, I won't say totally open, but you've got a lot of availabilities right now as
Yep.
you're just getting started.
It's growing, and that takes time.
We wish you the very best.
Thank
And Thank
you.
you for coming in, and thank you for coming
Thank
to
you for
Dent
your
County
time.
and being part of our health center, which Zach does a tremendous job
He
down
does,
there.
yep.
It's a great team down there, isn't
I
it?
really feel lucky to be a part of it because it is a great team.
April, thank you again for coming.
pleasure.
in. Appreciate it.
Thank
Keeping it
you.
at KSMO, we have civic happenings coming your way for First AP News and statewide news from the Missouri Net.
KSMO Salem.